Every year, many children could be at risk of having a potentially life-threatening asthma attack when they go back to school, as their airways can be more sensitive to asthma triggers. The transition back to the classroom often brings exposure to new allergens, increased stress and changes in routine, all of which can contribute to heightened asthma symptoms. Ensuring correct use of inhalers with a spacer can help get the full benefit of asthma medication to control their asthma.
Free-spirited and active, Thomas is enjoying all the things a boy his age does. But like 1 in 11 youngsters in the UK, he lives with asthma. An attack can come on at any time, triggered by a host of factors. It's important that he has an inhaler with him. But as he grows, so does his self-image, and his mum is concerned he may not always take his medicine, which could have devastating consequences.
I would say it was probably a bit easier when he was younger because he would do as I asked. He was okay actually, up until recently, where we have to do lots of prompting to remind him to take it. And there's a little bit of embarrassment at school because he feels like he's going to be taken aside to be given some medicine if he needs it whilst at school. So we're just in that period, that transition period now.
Every September, there is a surge in children and young people being hospitalised because of their asthma. It's often linked to changes in weather, seasonal viruses, and falling out of their asthma care routine, making them more susceptible to triggers that result in asthma attacks.
We have this week 38 spike. So it's recognised that sort of about 21, 22 days after children return to school, after the summer holidays, that incidences do escalate and rise. And everybody's asthma is different. Everybody will have a different trigger. So, it really needs to be personalised, and schools, parents, children, young people need to understand what their triggers may be and how that might affect their asthma. I think for young people it's about them understanding the impact of not maybe using their medication. I think particularly as young people hit adolescent phase, we know that they do undertake risks. That's part of growing and thriving as an adolescent, but they do need to be clear that they do need to be carrying their metered dose inhaler and a spacer if that's what they've got.
Getting asthma deaths down is a priority in the UK. Campaigners are trying to encourage the government to make changes, as well as educate individuals on their own asthma management.
So I think that the most important thing is awareness of how serious asthma can be. The National Review of Asthma Deaths did a report 10 years ago in 2014, and it gave a number of recommendations. Most of those recommendations haven't been acted on, and as a result, asthma deaths have actually increased by 25% in the last 10 years. So the situation is getting worse, and that's why we want the government to take action on asthma. If you can get the right management, if you can have an action plan, and if you're using your inhaler correctly and you're using a spacer to get the gas correctly into your lungs, actually we know that asthma can be something that's completely manageable. And really that's the tragedy, that nearly all the deaths of asthma in the last, 10 years, but even before that, have been mainly avoidable.
Asthma self-management can be a challenge. It's important to get the right advice from healthcare professionals, but also look at what technological developments are out there. Trudell Medical co-designed the compact and portable aero chamber to go, combined spacer and protective case with patients to ensure it works for them on the go.
By having people come in, we're able to watch them interact with the device. How fast could they get the device open, get the inhaler inserted in the back, get it up to their mouth and take their treatment. All these things that we want to do to make sure the device is going to survive whatever environment it's going to be placed in when people are out on the go. So over the years, what we've been doing is we've been developing models, recording breathing patterns of people actually taking their inhalers, trying to get closer to that real life simulation where how do people really breathe? We're not breathing normally when we're having an asthma attack. So that's the problem when we try to use the inhaler alone. We're inhaling very quickly. And that's not the thing you want to do, because what will happen is you've sped up those particles. They're going to impact in the upper airway. They're not going to get to the lungs where they need to go.
And using a spacer slows these particles, making them easier to inhale, ensuring more medication reaches the lungs.
Do you think this might really make a difference, that you might end up using your inhaler more often in public?
Yeah.
Yeah, I think this is probably a good thing for you, because he's definitely become more self-aware and more worried about what people think of him, especially now he's growing up. And for it to be this discreet, it's great.
As many as 4 people a day die in the UK from asthma, but it doesn't have to be this way. Getting access to the right information and treatment means that people with asthma don't need to be limited by their condition. Any device that helps people easily access and inhale their life-saving medicine when they need it most is a great step forward.